There's never a good time to be diagnosed with a serious disease, let alone in the middle of a worldwide outbreak. For people who are just finding out that they're very sick or they're already in the middle of the fight, the coronavirus puts them even more at risk. Team 12's Jen Wall has a story of how one Valley mom is doing everything she can to beat cancer and the odds.
Battling cancer is hard enough without having to worry about getting sick with the coronavirus on top of that. But in the middle of a worldwide pandemic, these patients are being forced to face their treatments alone, some even taking extreme steps just to survive.
It would be very likely that I would die if I got the virus.
Words Haley Essig never expected to say out loud, but that's a reality for her now.
I was angry, I was sad, I was really scared.
Essig is a mom of 2 little girls and a wife.
And it's scary. It's scary to recognize that our lives are never going to be the same.
She was diagnosed with stage 2 Hodgkin's lymphoma at the start of the coronavirus pandemic in the U.S.
You know, they say 85% survival rate for this cancer, and all I hear is 15% chance of dying, and that's terrifying.
She says she was given a good cancer prognosis from doctors, but the coronavirus has changed a lot when it comes to her treatment, medical visits, and home life.
Going through cancer is something that's really scary, and it's something that I would like my husband, my family to be there with me. They all want to support me and be there for me, but they're not able to.
But Essig says she has to go to treatments alone. One step Dr. Andrew Carroll says Valley hospitals are taking to keep sick patients safe.
Most hospitals are designating certain floors or certain areas for coronavirus so that everybody who goes to those floors knows that they need to do all the respiratory protection.
Starting before patients walk through the door.
Everybody's being screened before they go to the hospital. I think even before you go into the emergency room, they're screening you to make sure you don't have COVID.
For Essig, what she calls her new normal has already begun.
We're wearing masks when we leave. I wish everyone would wear masks when they left their house.
As she gets ready to start chemo soon, alone, fighting for her family.
And I've accepted that now, and now that we're moving forward with treatment, I feel ready to just take it on.
While doing everything she can to avoid the coronavirus. Dr. Carroll tells us ER visits are actually up right now because people are worried about the coronavirus. And he says as soon as primary care physicians can do more testing on the front lines, it should relieve the influx of patients at emergency rooms. For now, we're in Phoenix. Jen Wall, 12 News.